The presentation that was done as part of the satellite symposium really tried to provide oncologists and BMT specialists with an overview of the use of CAR T-cell therapy, specifically in diffuse large B-cell lymphoma and mantle cell lymphoma. We now have 3 approved drugs in the third-line space in diffuse large B-cell lymphoma, including Axicabtagene, Ciloleucel or axi-cel, tisagenlecleucel or tisa-cel, along with lisocabtagene, maraleucel or liso-cel. And with now more mature data, we do still see really promising results where approximately 40 to 50% of patients do have durable responses and remissions in the third line setting when that treatment is used. And certainly we now also have a growing array of real world experiences, both from the CIBMTR along with many other groups, which have shown that the use of CAR T-cell therapy in the commercial space does in many respects mirror the results of the clinical trials. And certainly one of the other important things to note is that the safety does appear to be at least on par or potentially improved from what was noted in some of the pivotal trials. Additionally, as part of that forum, we also discussed the now 3 pivotal trials which explored the use of CAR T-cell therapy in the second line setting in patients with diffuse large B-cell lymphoma. And that was really presented recently with the Belinda trial, which looked at salvage chemo and auto stem cell transplant versus tisa-cel, the ZUMA-7 trial, which compared the standard of care approach to axi-cel, and then the Transform study, which similarly compared these 2 CAR T versus standard of care. 2 of those studies were positive, the ZUMA-7 and the Transform study, which actually showed an improvement in event-free survival in the CAR T arm over the standard of care approach. There were some differences in trial design and patient population and within the Belinda trial, and that may explain some of the results of that trial where we did not actually see an improvement in event-free survival compared to the standard of care approach. But really based on at least the data from the ZUMA-7 study, now we do have an approval for CAR T in the second line setting. So Axicabtagene Ciloleucel is now approved in patients that have either primary refractory diffuse large B-cell lymphoma or those that are relapsing within 12 months of initial frontline therapy. And it'll be interesting to see how the landscape sort of changes now that we have this new approval and how that may also play into referrals and evaluating patients. And then one of the other aims of that symposium was evaluating and looking at really the changing landscape of mantle cell lymphoma. In mantle cell lymphoma, one of our typical frontline treatment approaches would be intensive induction therapy, transplants, and then maintenance therapy. But in the relapsed refractory setting, now there's multiple agents approved, including brexucabtagene autoleucel, which is the CAR T-cell product from the Kite Gilead group, which has been approved for patients that have failed just one prior line of therapy. And what we had done in that symposium was essentially just review some of the data from that, showing some of the beneficial effects of CAR T therapy in mantle cell lymphoma, including high response rates and encouraging durability. And there's also data to substantiate the use of liso-cel in mantle cell lymphoma, and that product is currently in late stage clinical development for that indication.